Madam Secretary, welcome. And just want to, one quote from the President. Under the plan, if you like your current health insurance, nothing changes except your costs will go down by as much as $2,500. You remember that quote? It was quoted quite often in the health by the majority party, claiming that premiums were going to go down. Well, I actually just got off the phone with one of our larger employers in the state of Nevada, and most people recognize his name, Steve Wynn. Asked him if I could quote him, which he said it was okay. He's probably the most employee-friendly employer that we have in the state of Nevada for years. Unions love him, his workers love him, he treats them like gold, he does everything he possibly can. Well, these are the statistics that he just gave me. From 2005 to 2010, they had a steady rate of increase in their premiums around 8% a year, which is high. We all agree that that's high. This year's premiums went up by 12%, almost a 50% increase in the rate of growth. What did that mean to the people that are working for him? That means that his people, he took on some of those costs, but not all of them, and the average worker that works for the Wynn Resorts now will pay an extra $800 to $900 a year. So their premiums didn't go down, they actually went up. And he, based on the people he has, experts he has working for him, have studied the system, and they think that actually things are going to get worse in the future, not better. He also, their plan worked with other plants across the valley to find out. One of the big selling points was, well, you know, we're going to have fewer people going to emergency rooms. They have had no decrease in the number of people going to emergency rooms, but they have had a decrease in the number of doctors now practicing. So I guess some of the promises, and this is just an anecdote, obviously, but I have talked to employer after employer after employer across the state of Nevada, and small employers had much larger increases than what he just had. I've had people tell me, the small employers, that their premium increases were as much as 35% increase this year. And that was even with increase in the copays for their employees. So I guess the bottom line is that at least what I'm seeing in the state of Nevada is that the health care reform bill is driving up costs, not doing what it was promised to drive down costs. How would you respond to that?
Well, Senator, I don't think there's any question that costs are continuing to increase. And I think, unfortunately, that trend, it's almost impossible to say what the trend would have been absent the bill. I can tell you that the status quo, as I think you and I would both agree, was totally unsustainable and unacceptable. I in fact, am somewhat stunned that Mr. Wynn's premiums have gone up at that slow a pace during those 5 years, because that was not the average. The average during those years was people were seeing over 100% rate increases over that period of time.
That's because they've implemented a lot of things in his employ that try to work with their employees to encourage healthier behaviors and things like that. They've been doing some of the same things that Safeway has been doing to try to hold those premiums. But the point that he made is, for 5 years, they basically had a level, 8% increase per year.
Well, the insurance industry overall has indicated that in this last 12 months that there are not significant cost drivers related to the implementation of the Affordable Care Act. That's what the industry is saying as they analyze their rates. They're saying it's the underlying rise in healthcare costs and the underlying utilization of healthcare. Again, the Affordable Care Act, I think, for the first time, has some delivery system changes, which have never been part of the dialogue before. And I think not only will they impact what Mr. Wynn's employees are seeing in the private sector, but they certainly will impact the long-term deficit in the public sector. Those are clearly not showing up in the first 6 or 7 months of implementation of the bill, because the structures are not even in place yet. Emergency room decreases, I would suggest, Senator, will not occur until the vast majority of uninsured have access to insurance coverage, and that does not occur until 2014. So some of the examples that you cite absolutely are underway, not only in Nevada, but in other states around the country. But as this law is gradually implemented, I think you will see a change in those dynamics.